Hi everyone, my name is Celeste. Thank you for watching my video, and I look forward to working alongside all of you in this course. My first field placement was at Geisinger, Wyoming Valley Medical Center, which is also my place of employment. I'm a nursing assistant there. I worked alongside a medical social worker from the care management department, so my experience was phenomenal there. I learned a lot more and actually brought together, the patient's whole stay in hospital, from being on the bedside care of things working and then doing clinical and helping them get out of the hospital and setting up those plans. Generally what we would do in clinical is we could be assigned to any unit in the hospital, sometimes OB, med surg, ICU, the ER. They did try to keep you in the same department for a few days because consistency is the best thing when it comes to this kind of job placement. Then what we would do on each unit is you would attend the IDT meeting, which is an interdisciplinary team meeting. That is where you have doctors, pharmacy, physical therapy, dietary, care management, all together to discuss each patient and their status, and if they're going to be getting discharged that day or within the next few days, to start discussing a discharge plan. So we would set up the discharge planning, whether it be home health, going to a SNF, or going to rehab. And we also did help set up hospice, whether it was an inpatient or in-home hospice for the family's relative. Sometimes we would run into some trouble where we would have to do what's called a PASSAR form for patients if they had a mental health history and are being placed in a nursing home of some sort. That's a state document that has to be completed in Pennsylvania. Also, we worked closely with Area Agency on Aging for any individual that was elderly and came in and perhaps didn't live in a safe home. We would have that organization run through the state, come in and assess the patient and discuss further placement. My goals for developing into a clinical social worker: I really would like to learn how to further assess, diagnose, treat, and prevent a variety of patients. I know that's a wide array of a subject, but I definitely want to further all those. Also, specializing in emotional, mental, and behavioral disorders is something that I really would like to focus on, even though those kind of patients do have subcategories or other situations going on as well. I feel like having a background on all those would definitely bring together a treatment plan and create a better outcome for a patient. Something long-term I could see myself doing after a few years as a clinical social worker would be possibly opening up a private practice where I can bring in a clientele of what area I would like to focus on. And as well, maybe even with opening up a practice in the future, I feel that that's an opportunity to combine medication and therapy as well. Even though as social workers we can't do medications, I feel like it's something to definitely learn about and be in the know about as a social worker, because your client might be seeing a psychiatrist, which is a person that can give them medication, and being in contact with them and correlating with the patient. I do see this as an opportunity to see what area of social work I would like. So say I want to focus with bipolar patients, this is definitely an opportunity to do that. One challenge that I do see coming up eventually, and I do want to face, is working with families. So say there's a family with a problem going on, they want to do group therapy session. I honestly don't have much experience with that yet, and that's definitely something I want to work on, because say you have a bipolar or schizophrenic patient and the family in general is just having a lot of trouble and they want to come for group therapy, that is something I definitely want to work on and gain more skills on. Best of luck, everyone. Thank you.